Testing, 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 test, test. Okay.
Dear members of Academy of Science and Art of Bosnia and Herzegovina, dear colleagues, ladies and gentlemen, I have a pleasure to greet you on behalf of the Academy of Science and Art of Bosnia and Herzegovina and Department of Medical Science, and to present you our today's speaker, Dr. Suresh Mukherji. Dr. Mukherji, currently professor of radiology of the University of Illinois, University of Louisville, professor of radiation oncology at the Robert Wood Hospital, Medical School, Rutgers University, otolaryngology, head neck, surgery faculty, and Michigan State University and faculty in the Department of Oromaxillofacial Radiology at Texas School of Dentistry. He is past president of the American Society of Head and Neck Radiology and has authored over 500 scientific manuscripts, chapters, and editorials. He has written or edited 15 books, and he is a developed educator and has been an invited speaker on over 600 occasions on 6 continents. Today, Professor Mukherji will speak on artificial intelligence in radiology, truth and myths. Dear Professor Mukherji, I have a pleasure to invite you to take the floor and deliver your lecture, which we wait to hear. Please, you are welcome.
Thank you very much for having me here in Bosnia and the honor of presenting in this academy. It's my first time. It's actually my, I think, 6th time to the former Yugoslavia, but my first time to Bosnia. So it's a real pleasure. I want to thank Svetlana for arranging everything. And many of you know I'm here because of the Erasmus meeting, which is a European Congress where we have speakers from all over the world. So I want to thank my host, Zublea, and also everyone that organized that committee. It is the first time the Erasmus course was held here in Sarajevo, so I think it's a tremendous acknowledgement for not only the accomplishments that's being made by this country, but the future as well too. So I know the challenges in the past, but I think the future is very bright. So I look forward to working with you and hopefully continue this relationship for many years to come. So thank you very much for having me. I'm also very impressed that you have a vice president that's a radiologist of the Academy. So that's makes it a little bit easier as well. Can everyone hear me okay? Okay, I'll try to speak slower. Sometimes I speak a little fast, but I'll try to keep it a little bit slower. But anyway, thank you very much. The title of this talk is going to be Artificial Intelligence in Radiology. And we're going to be discussing some of the truths and some of the myths. So just a disclosure that I have to mention is that I do consult for a artificial intelligence company that doesn't create a product, but it is a platform for different AI companies. So we have access to about 200 different softwares in AI. So my experience is not really based on one company or working on a specific research project, but rather I think I've got a pretty good sense of the different landscapes that's available in the future for artificial intelligence. Also, we use about 18 or 19 artificial intelligence projects in our current practice. So not only are we performing some investigative work, but we're also using a lot of this in our clinical practice. So I'm not going to be mentioning any of these by names, but just to let you know that we do have some degree of familiarity regarding how AI is used specifically in radiology, but we'll be talking a little bit more than just radiology. So what is artificial intelligence? Well, artificial intelligence is not new. It's a branch of computer science that's dedicated to creating intelligent machines, and they're felt to work like humans. And so when we work like humans, we tend to think, we tend to reason, and hopefully some of the behavior is like humans as well too. And I'm sure if you read the press or if you talk to Elon Musk or Mark Zuckerberg, you'll hear about the future of AI potentially replacing humans. I think that's a long way off, but when you do talk about artificial intelligence, you do tend to hear about humanoid robots like this. And I don't know if you've ever watched this American show. This was Jeopardy. And so one year, a few years ago, this IBM Watson computer ended up beating this very well-known champion in the United States. So at that time, 10 years ago, there was a lot of concern that humans would be replaced by artificial intelligence, but certainly that has not been the case. Now, artificial intelligence is actually a pretty old field. It's not something that was developed 10 years ago. Artificial intelligence was first, if you will, founded in 1956 at an American college, which was Dartmouth College. And at that time, and again, this is 2025, so it's actually 70 years ago, they predicted that machines would be as intelligent as humans. So what we think now was predicted about 70 years ago. Now, what happened at that time is that there was obviously a lot of enthusiasm, a lot of verve, that this is a fantastic area that needs to be explored. But unfortunately, around in 1973, the funding for this new type of technology was limited. And so between about 1973 till around 1980 or so, it went through what we refer to as an AI winter because there were really no innovations that were associated with AI. So it sort of, if you will, died off or went to sleep. Now, something happened, obviously, between 1980 and now that revived artificial intelligence. And the question is, what is that revision due to? Well, it was actually due to gaming. So I'm looking in the audience right here, and I don't see that many people that I think would be in front of a computer playing video games. Maybe a couple. But in general, I don't know if you play video games. I don't play a lot of video games, but my son plays a lot of video games or played. Your daughter played. And so I would like to thank them for that because of them, they're the ones that help drive companies like NVIDIA, which is now the most valuable company in the world, to try to develop more powerful chips. And these are both CPUs and GPUs. And because of this innovation, a lot of it due to gaming, this provided the ability to run these very complex formulas and programs that are generating and pushing the innovation in artificial intelligence. So it's really because of this AI boom was really fueled by these advancements in these GPU and the CPU processes. Now, when I talk about artificial intelligence, I'm going to use this parable right here. Now, I don't know how many people are familiar with this, but me being Hindu, me being Indian, this was actually an old Indian parable. And it was blind men that are looking at the elephant. And so you have a bunch of blind men that are now trying to figure out what an elephant is. So when you look at this elephant, you have one person back here that's grabbed the tail. So he thinks the elephant is actually a rope. Then you have this person right here that's grabbing on the leg of the elephant. And he thinks, I figured it out. The elephant is actually like a tree. And then you have this person that's grabbed onto the tusk of the elephant. And they think, wow, this elephant is like a spear, like a weapon. And then this person grabs onto it and he says, my gosh, you know, the elephant right here I guess is more like a snake. So the point is that when we look at something as immense as an elephant, every individual that is grabbing part of it has their own perspective or their own personal view of artificial intelligence. So I have the privilege and the honor to speak in different groups about AI. And so when I speak to radiologists, the number one thing that comes up is, can artificial intelligence help us interpret our CAT scans and our MRI scans or our mammograms better? But in actuality, when I talk to other groups, so for instance, my daughter is a software engineer. When I talk to her about artificial intelligence, she's not really worried about how well her brain MRI is going to be read, but she's really more worried about these really interesting algorithms and these advancements. When I talk to people that are working in regular jobs, or maybe they're getting a little bit older and now they hear about artificial intelligence, they're worried about, hey, am I going to lose my job? When I look at other people, let's just say if I was recently in Austin, Texas, and I don't know if you've heard about this, but I took my first driverless car. So I jumped in a taxi, I called my Uber up, it shows up, the door opens, I jump in, there's no driver, and off we go. So the thing is that that's actually AI driven. So my point is that when you talk to the 99% of the people in the world about artificial intelligence, they all have their own perspective and their own opinions about AI is going. And I'm sure all of you are familiar with AI in all of your lives. It's permeating everything. If you've ever done a Google search, you know, every time I Google something now, I now have an AI summary of what I'm looking for. I don't know if you spend much time on X, you have your suggested tweets. My daughter works for Pinterest. Has anybody heard of Pinterest? That's the Pinspiration. So my daughter works for Pinspiration. Maybe she's the one that's sending you your stuff. I don't know. But again, all of this is really artificial intelligence driven. And certainly for Amazon, every time I purchase something from Amazon, the next time I log into Amazon, I'm getting 10 other recommended searches. So my point is that when we do talk about artificial intelligence, we all have different perspectives of AI. Now, when we look at artificial intelligence, all it is, it's mathematics. There's really nothing magical about it. Now, all of you in the academy here are very learned individuals, and I'm sure we all did wonderful in college. But the one course that made me have very gray hairs, because I have a lot of gray hairs right now, was statistics. It's something that I really didn't like very much. And I see some noddings, right? No one really likes statistics. But basically what artificial intelligence is, it is a way of mathematical models to help us predict the future. So for instance, when I jumped in my driverless car, there was some type of algorithm that prevented us from hitting another car or prevented us from going forward and getting there safely. You know, when it comes to things like Pinterest or maybe these Amazon things, what the algorithms are doing is indicating to the company that there's a higher likelihood that me as the customer is going to buy their product. So really all it is some type of predictive analytics. And it's really based on statistics. So some of these terms right here may give you some nightmares. So for instance, linear regression and logistic regression, I don't know if you remember things back in undergraduate, but just to give a little bit of granularity to this, I'll run through something that's one of the basic forms of artificial intelligence. And this is something that we learned back in medical school for myself, but also when we were in undergraduate. So let's say that you were starting a company and you wanted to say, what should my salary be if I'm an employee and I'm 35 years old? So you have someone that's a 25-year-old making $50,000 a year, and then you have a 57-year-old making $180,000 a year. And now you come in and you're 35 years old and you ask yourself, how much money should I get? What should I be? Should I ask for 180,000 or should I ask for 50,000? So that's what the employee wants. But if you're the employer, you're like, well, I don't want to pay you that much money. How am I supposed to figure this out? So this is how we use terms like linear regression. So what you can do here is that you can take, this is the salary of a 25-year-old, here's the salary of a 57-year-old, so what do I pay this person? So you have a lot of data points in here, but I'm only showing 2 data points. So what do? Well, what you try to do is somehow figure out linearly where this person should land up in the pay scale. So you put a line like this, and you'll say, well, let's see what we do here. Here's this one, and what should we pay this one? But what you end up doing is when you put this line right here, you then measure the error. So when you measure the error like this, you'll say, that's the error between what I think I should predict and what you could actually make. And you can see it's a pretty big error. So when I add up this and this and this, it's pretty big. But on the other hand, what linear regression does, it allows you to draw some type of predictive line here that's going to minimize the error regarding what you should pay that person. So when you redo the error, that's what your error looks like. So what this allows you to do is predict the salary of what you should pay this person, so it tries to be fair. So this is the line that's created. And in this case, for someone that's 25 years old, you pay him 50,000. For someone that's 57 years old, they're getting 170,000. So what would that young 35-year-old make? Well, based on the linear regression model, the predictive analytic, they should be getting paid about $80,000, and that's fair. So that's one type of just predictive analytic that forms the basis of artificial intelligence. So when we look at artificial intelligence, there's some terms that we need to be familiar with. So overall, the big term is AI. We're all familiar with that. But when we start looking in more detail, we have these terms such as machine learning. And what's machine learning? Machine learning is a subset of artificial intelligence where the machine learns from manually defined features. And I'll go over this in the next slide, but this is not automated. This is where you get someone to help train the computer, and oftentimes it's a real human. Now, what is the concept of deep learning? Well, what deep learning is somehow the computers learn on its own. So when you start hearing the end of mankind, and you start hearing about these supercomputers where somehow these computers are going to learn from their mistakes automatically, this enters the area of what we refer to as deep learning. So here's an example of machine learning. So I know not everyone here is a radiologist, but let me just summarize it here is that this is a brain. And does that look normal or abnormal to you? Abnormal, another neuroradiologist. Good, excellent. Right? So it looks abnormal, right? So obviously you can say it's abnormal, but what does machine learning do? So when you see something like this, what we're trying to figure out, yes, it's abnormal, but can we actually predict what the diagnosis is? So how do we do that? Well, what we do is that we take these different sequences, another term for pictures, and what we do is try to assign and quantify what the shape is, the size is, whether or not this tumor is enhancing. This is without contrast, this is with contrast. We can see, for lack of a better term, it's lighting up. This one is very, very bright, and this one's very bright, but these are different ways to take our pictures. This is what we call T2, and this is what we call T1. But you can see every time we look at this, there's different ways that we can describe it. So in this one, we can say, well, it's not really a circle, it's not really an oval, but somewhere in the middle. We can see that this area is very thin, this is very thick, but this is part of the challenge that comes in. If you close your eyes and I try to describe this to you, it's really harder than you think. So what we do is that we have different humans that try to train the computer by looking at thousands of these data sets and say, yes, this looks like this is this, and we ascribe it to a specific diagnosis. Now, obviously, this is very manually intensive. Can you imagine being a medical student or a resident or a radiology junior faculty and going through thousands of images and then trying to manually train a computer to help us make the diagnosis. So, but that's the whole concept of what machine learning is. Now, the other thing is what we refer to as neural networks or convolutional learning. So this is an example of a machine learning. Now, this is what we call a neural network. Now, if you look at this, this looks like something in the brain. This is an axon. So it's like it looks like a nerve in the brain. And this is where we get the term a neural network. So this was a paper that we published back in around 2000. And I remember I was working with a very smart medical student. This is long before I even heard of artificial intelligence. And so we were doing a study using something called spectroscopy, where we had a bunch of data and we were trying to predict whether something was a tumor or non-tumor. And he says, hey, let's use this thing called a neural network. I'm like, what's a neural network? I've never heard of it before. Well, it turns out I wasn't smart enough to figure it out, but this is one of the bases of artificial intelligence. So for instance, if I close your eyes, if you close your eyes right now, don't look at the slide, just close your eyes. And if I describe something and I said, it has 4 legs, it has fur, it has large eyes, it walks, it claws, and has teeth. What kind of animal do you think I'm describing? Could it be a lion, tiger, a bear? So each one of these basically has equal weights for you to try to predict what I'm trying to describe. But now, what if I said it purrs? Then what do you think it's going to be? A cat, exactly right. So when we talk about neural networks, not all of the information that we provide the machine is equal. So for instance, the 4 legs, the fur, the large eyes, walking, that could be a dog, it could be a cat, it could be a lion, it could be a bear, it could be a fox, for all I know. But as soon as I said purr, then you can determine that it's probably a cat as opposed to not a cat. So that's how we use machine learning to help describe things, but all of this really has to be manually inputted. Now let's talk about deep learning. Now, what exactly is deep learning? This is that whole concept where we look at something, and hopefully this is going to work. That's that whole concept, yeah. When we look at something, we don't have to put manually, but the computer is able to learn on its own. So what I want to do is at least give you a snapshot. So when you hear about this whole concept about robots taking over the world, this is what it's sort of based on. So what we have here, if you can look at this, this is somewhat similar. Can you see the similarities between this and this? Somewhat similar, right? So what ends up happening is that you have the information that's put in at this level. And then eventually it goes from the left to right. So the computer takes all this information, it takes to optimize it, and then figures out the results, the prediction. Sometimes a prediction's right, sometimes a prediction's wrong. If the prediction is wrong, what ends up happening? Notice how all of this information is going from left to right. So you see everything's going from left to right? Now it determines whether it's right or wrong. Now look what happens. Now it's going from right to left. So remember when I looked at this image right here and I was saying whether it was a cat or not a cat, you really couldn't figure out from the top 5. But once I told you it purrs, it's like it is a cat. So therefore, when we now go from right to left, what it's telling us is that, hey, this is the most important input. And therefore, in the future, we need to have more weight on this so we can probably predict whether we have a cat or a dog. So this is the whole concept of back propagation. So it goes from left to right, then it goes from right to left, and it continues to learn. So therefore, when you hear about robots taking over the world, it means that it's interacting with the world. It figures whether it's doing something right or it's wrong, and it self-corrects. Everything is automated. So this is one of the bases of artificial intelligence when it comes to deep learning, the ability to learn on its own. So when we talk about radiology right now, when I look at radiology, there's over 409 different products just in radiology. In fact, if you look at all of the different types of products in medicine, and I'm not just talking about radiology, I'm looking at orthopedics, neurology, all of healthcare, 75% of all the products are actually in radiology. So we've played a really central role. And part of that is the fact that when we're in radiology, we're just looking at data. We're just looking at ones and zeros. It's not like we're necessarily talking to the patient. We do talk to patients occasionally, but when you're analyzing the images, it's really based on the data. So when you have a CT or an MRI scan, it's all digital information. And you can take that digital information, and that's why we've become so prominent when it comes to AI. So when we do look at AI in radiology, I'm going to go back to the parable right here where everyone has a different perspective. So when I ask you about radiology today, when I did the interviews, a lot of it was based on the ability to analyze the images. But if you're actually putting together a radiology department, it's more than just the diagnostic utility. If I'm putting it together a radiology department, I want to know which patients are going to show up. So if I have like 20 or 30 people in the room and you have an appointment tomorrow, there are going to be 5 or 10% of you that are not going to show up. So I want to use my algorithm to say which ones are not going to show up. Because if you're not going to show up, then I can maybe schedule a different patient. So it makes us more efficient. Similarly, when you come in for any type of study, you want to get the right study. So their algorithms going to help with that. There are algorithms that now help with making sure that we can image faster. And especially with radiation, all of you are familiar with radiation, with CAT scans and so on and so forth. There are now artificial intelligence algorithms that can actually reduce the radiation dose. So again, this is things that can help society as a whole, but it still falls under radiology, and it's not necessarily based on whether or not we can pick up a nodule in the lung. So these are just some quick examples. This is an example of MRI scans, and this shows the reduction in the time. What this tells us is that we can actually reduce the time to acquire the images in half. So what does that translate to? I don't know if you've ever had an MRI scan, but I have yet to see a patient that has had an MRI scan and has loved the experience. Most people say, I don't want to get in that magnet. It's narrow, it's loud. I can't hold still, right? So any way that we can actually reduce the time in the magnet, well, that's good for the patient. But also here, when you look at the healthcare system as a whole, if I can do my patients in half the time, and I have patients that are waiting 2 or 3 weeks for an MRI scan, if I can improve my throughput, that means I can provide better access to my patients, because all of a sudden there's going to be more opportunities to put them through because I'm not spending as much time on each patient. Oftentimes what we can do too is that when you come into work in the morning, in the United States, some of our work lists are in the hundreds or the thousands. We're not quite sure when we look at our list which one of these are positives or negatives. And I know I've seen numerous instances where you have about 500 patients on the list, and then patient 449 has a brain bleed. You know, and I'm not going to read patient 449 until I read the first 448. So you can see if that patient has a brain hemorrhage. It's not very good quality if all of a sudden I have to go through the first 448 to find the patient that's abnormal. So there are certain ways with artificial intelligence that it can screen these patients, tell us which ones are normal and which ones may be abnormal. And then what happens, it moves these to the top of the list. And as a result, there's a 25% reduction in the time that it takes. So we can see that these cases are put to the top of the list. And again, it makes us more efficient and provides better quality for the patient. Now, when we talk about neuroradiology or any type of radiology, if you name a study or a pathology, there's an application. There's something already created. Like I say, I work with a company that has 200 different types of products. So we have products, and what I do is in neuroradiology to look for hemorrhages. We can measure volumes in the brain. We can look for stroke. If you're a musculoskeletal, let's say if you hurt your knee, right? You may have a fracture. We have algorithms that help identify fractures. If you have arthritis, we have algorithms that can help you identify the type of arthritis that you have. We have algorithms that help you identify your curve in your spine. And sometimes you age differently. So we have actually algorithms that can predict your age as well. I look at the room, we have a lot of women in the room. I'm sure, I hope all of you, you're getting your mammograms. I assume there's a screening mammogram program here in Bosnia, but I hope you're getting your mammograms. In artificial intelligence, we have ways to detect the lesion, we have ways to characterize the lesion, and we also have ways right now, if you're getting a breast MRI, that we can actually predict any nodules that you have in your breast or whether they're malignant or not malignant. And in the chest, we have ways to look for lung nodules. We can predict whether you have some type of diseases like tuberculosis. If all of a sudden you present with chest pain, you may have a clot in your lung. We call that a pulmonary embolism. And we also have ways of predicting whether or not that you actually have a lung cancer in your nodule. So again, these are all products that are currently available. So you can see it's very exciting, right? So we've talked already in the first 30 minutes or so saying, wow, maybe there are computer algorithms that can learn on its own. Maybe the humans will be taking over the world. Maybe robots will be taking over the world. But when I look at 200 or 400 products, and we're looking how we as radiologists interpret studies, some people say, and I have to say, my daughter got married last week, so I'm very excited. And I was talking to my brother-in-law, who is an entrepreneur in Silicon Valley, who's a tech person, and he essentially said, you're not going to need a lot of radiologists in the future. So even now in 2025, there's still a sense that radiology may not be needed. Well, back in 2016, when we had this avalanche of enthusiasm for artificial intelligence, some very smart people predicted the end of radiologists. Some of these were actually radiologists. Some of these, I don't know if you know who that person is, were pretty well known politically. And this person right here, who's considered the father of AI, and if you sort of keep in touch with the Nobel Prize world, was awarded the Nobel Prize in 2024 for artificial intelligence, predicted back in 2016, AI will be superior to radiologists. We should stop training radiologists. We have plenty of radiologists. So unfortunately, during that time, the extinction of us as a profession was predicted. And unfortunately, a lot of our own colleagues in radiology jumped onto this. And we would go to our national meetings and they would say, well, maybe we don't need to train as many radiologists because it seems all the really smart people are saying they don't need us. So at that time, I don't know if you know about the Marvel heroes, maybe your kids do or not. I think this is Captain America, that's the Hulk. There was a sense of the AI is going to save the world, right? It's going to be the end all and be all. But now we sort of have to ask, will artificial intelligence save the world? And so what this is this is a curve that's created by a consulting agency called Gartner. So Gartner is a big consulting firm in the United States. And what this curve shows is a predicted consistent path for any type of new technology or innovation. And on the x-axis here is time, and on the y-axis here is the expectation of that new developed technology. And you can see when you have a new technology, there has a very, very steep slope. And this is what's referred to the innovation trigger. Now, the innovation trigger is really important because I don't know if you've ever started a company or not, but if you have a new product, you have to create attention and you have to create buzz. So if you have a new product, unless you're Elon Musk or Zuckerberg or Bezos, you can fund yourself. But on the other hand, even when Jeff Bezos started Amazon, it came out of his basement. So he had to figure out a way to get money. And the way you do that is that you have to increase your expectations. So as this technology develops, you have to have high expectations because you have to have some type of venture capital money to start a product. After a while, what ends up happening is you reach a peak and then all of a sudden your expectations start to drop. And this is called the trough of disillusionment. It's kind of a funny name. But you can see some of these products are actually in the trough. And then eventually you have some type of plateau. So when we looked at this curve, and this was 2017, remember the quotes I just showed were 2016? When you look at 2017, remember deep learning and machine learning? I mentioned those earlier. Has everyone forgotten what I've said? Svetlana, did you forget what I said already? I think she fell asleep. I'm just kidding. So anyway, when you look at the deep learning and machine learning in 2017, it happened to be right there, right at the very top. Now, when you look at the innovation trigger, the Gartner curve 5 years later, look what happened to deep learning. All of a sudden, the expectations drop. This is also known as a trough of disillusionment, or you can kind of change that to disappointment. So something is going on. And I want to call your attention to this area right here, which is generative AI, which you're all familiar with. Does anyone use ChatGPT? Does anyone use anything like that? That's all generative AI. Grok is another one. So when you type something into Grok, this is all generative AI. So generative AI back in around 2022 is looking pretty good, right? It's going to be great. Then we have another one called foundational models, which is really part of the basis now with a new level of AI. But now this is the 2025. This was just released just a few months ago. And then what ends up happening is look at the foundational models in the generative AI. And when I give this talk to non-radiologists, they're saying, well, what do you mean now? AI is great. There's so much expectations. But the point that I want to convey to you is that radiology, because we're all digital and it's been implemented and we've been affected in our field, I would argue that our field is actually at the leading edge. So some of the expectations and the hype, and now some of the disillusionment that we're seeing in our field is not unique to us, but rather once you start looking at artificial intelligence and you start using it in your own environment, you may be disillusioned or disappointed as well. And feelings may replicate of what our field in radiology is already going through. So this is an example. This was a algorithm that helped us look for spine fractures. I don't know if you've ever had a spine fracture or not, but you can do a CT scan and we're trying to figure out there's a fracture. Well, there was a product that came out and said the sensitivity was almost 92% and this was 89%. But when we actually looked at the real world results from this, the sensitivity was only 55% and the positive predictive value was 40%. Now, I'm not a statistician or mathematician, but I think this number and this number is a lot worse than that number. So you have to ask yourself, what happened? What in the world? We're promised all these high expectations, and all of a sudden I implement this into my practice and it's not working as well. What happened? Why are we in this disillusionment phase? Well, part of the fact is that when you have a product and you create the product, the information that you're basing the product on are thousands of data sets that are very high quality sets, and there's no bias whatsoever. It's really, really high quality. Now, if I go to a radiology department, so in our practice, we have about 30 MRIs and maybe 20 CT scanners. The MRI scanners are of different vendors. They're different field strengths, they're different ages, and they have different softwares. So you don't have the heterogeneity. You don't have the homogeneity, I should say. There's a lot of equipment variations. And it's like anything else in life. You can't standardize everything, so you have a lot of variations. So as a result, the product is highly curated. It's based on really, really good data. But once you get out into the real world, it doesn't work as well. The other thing about, and this is unique not only to the United States, but in Europe as well too, is remember that thing I showed about back propagation where you go from the left to the right, it learns, it goes from right to left, and then it goes from left to right. You remember that whole thing, and eventually everything gets better. What the FDA and also what the European societies have done is that once you buy a product, it's locked. It cannot learn anymore. So the ability for a system to learn on its own is not now currently allowed in the United States or Europe. So therefore, if you have a lot of variation, that's why you're getting a lot of disappointment in the products that you're purchasing. The other thing too I want to emphasize is that when the FDA clears a product, if I go back to this slide, the FDA said 92% and 89%. The purpose of the Food and Drug Administration in the United States is not to act as a product advocate. It's not going to say, I'm going to guarantee that you have this degree of success. What the companies want to do is to say to the FDA, hey, this is as good as a human. And the FDA's role is to say it's safe. So essentially, if you just stick a software at the end of a CT or an MRI, you're not really hurting the patient, right? You're not going to harm the patient. You're not going to burn the patient. You're not going to over-radiate. It's just saying that it's safe. So when you do see these types of sensitivities and specificities and reports on how well it does, that's not a guarantee. It's just the role of the FDA to say it's still safe. So that's all that is. And you can also have some cultural variation and demographic bias. So let's just say I wanted to create an AI algorithm to predict the next president of the United States based on the election. So I look at this, and with all due respect, I see a bunch of old white men, right? So this is my training data. And I'm going to use this training data to help predict this election. Anybody remember who won this election? Yeah, so the algorithm broke down. So this is an example of cultural or demographic bias. And then the way we learn more and more about artificial intelligence and we train our systems, this is something that we're finding out right now, is that if we're going to have a really, really good algorithm, we just don't need MRs and CT scans from Boston and San Francisco from affluent people. We need to have information from India. We need to have information from low resource countries, so on and so forth. So that's just an example of that variation. The other thing in the United States, especially, is who's going to pay for artificial intelligence. Because, for instance, the way the US system works is I'm a radiologist and I get paid maybe $30 to read a study. And if I use an AI algorithm to help me look for a hemorrhage, I have to pay $1 or $2 from my reimbursement, and the AI algorithm may or may not make a difference. It's kind of hard to say. So this is just an example. This is a patient that has a brain hemorrhage here. So the algorithm says, hey, look really, really closely here because there's a hemorrhage. And I say, that's great. Now, for those of us that are neuroradiologists, we know that when we're looking at a brain, we want to look for hemorrhages, but we want to look at everything else. We want to know whether or not the patient has a stroke. We want to know whether the patient's ventricles are too big. We want to know whether there's a fracture. And we want to see if there are any tumors there. So in order for me to do this in the current setup of the United States, I have to have an algorithm that helps me look for a stroke, hemorrhage, chronic changes, large ventricles. So that's $2, $2, $2, $2, $2, $2, $2. So all of a sudden I take my $30, and if I use all of these things, I've got like $10 left. So I have to be really sure that the algorithms I'm using are going to be good, because I know they're not going to perform as well as we can. So again, these are one of the challenges that we've seen. Now, recently, there have been some new algorithms, and these are now present globally. They're not allowed in the United States right now, that can actually look at all of these things. So in the future, we do have the opportunity for some softwares to do more than just one analysis. So this is one of the exciting things that's coming down the pipeline. But when I see something like this, it really gave me pause as a neuroradiologist, because I say to myself, holy cow, if there is an algorithm that can look at stroke, hemorrhage, masses, maybe it is going to put me at risk, because this is essentially what I'm doing when I'm looking at a head CT. But fortunately, what I see is that when we're actually looking at the population of the world, the population is going to increase. We're all going to be living longer. And also the overall utilization of our studies is going to grow up. So in the United States, we already have a shortage of radiologists. In fact, when Jeff Hinton predicted there would be no radiologists, the extinction, if you're a radiologist in the United States coming right out of residency and you're willing to read everything, you can easily start off between 600 and 700,000 US dollars. So this whole concept about radiology going away, it's not going to happen. And as a result, when you look at something like this and the PET scans are growing, the ultrasounds are growing, the CTs are growing, one of the myths that I want to dispel, so you may not remember I'm here tomorrow, but there's one thing I do want to let you know. Will radiologists still have jobs in the future? 100% unequivocally yes. So I can assure you that we will not be distinct. But one thing I do want to point out is that when I look at a radiologist and I want to create a business, these PET scans and ultrasounds and CTs are pretty profitable. But the one thing we don't necessarily like to read are chest x-rays. So now there are new software algorithms that are coming out, and they can identify 124 radiological findings on CTs, on chest x-rays, I should say. So if I can make more money reading a bunch of MRI scans and CT scans, et cetera, and I don't want to read chest x-rays, and this is created by a company, is it possible that these AI companies can start their own teleradiology companies? Is it possible that I don't want to read these chest x-rays, so I'm going to send them to an independent company? Is it possible they may contract with their own radiologist and they can create their own companies? So it's not necessarily a threat, but in an odd way, it actually may make me more efficient. So that's just something to think about in the future. So I'm going to end the talk by giving you a little survey. And actually, I gave this to the Erasmus course, I think yesterday, right? And then afterwards, I do have a QR code at the end, and I'd love for you guys to participate as well, too. But so this is updated data as opposed just of this morning. So all of you have heard of artificial intelligence. All of you know that it's affecting our society. So I've done a very unscientific survey over the last 5 months as I've kind of gone around and talked to different radiologists around the world and asked just a couple of questions. And this is one of those questions. So this is updated again from yesterday. So I said, are you using any form of artificial intelligence in your radiology department? And the answer is about 76% are actually using some type of AI. Now, in your own mind's eye, you're thinking, aha, all these places are using this to help us identify nodules or identify brain tumors, et cetera. But then I asked the question, are you currently using AI in your clinical practice to interpret the studies? And notice how this number dropped way down to 46%. So how do we reconcile 76% and 46% in similar questions? The difference is this is allowing us to interpret the studies, but the 30% difference is that there are a lot of places that have artificial intelligence built into the department infrastructure. So things like protocoling. If you have bought a new CT scan or MRI scan, you have artificial intelligence built in to your new CAT scans or MRI scans. So AI is now slowly permeating the radiology departments, but it hasn't necessarily been used clinically to help us interpret studies. And then I asked the question, because AI has really been used in stroke detection, it's been just game changing. That's where it has been disruptive. If you take out stroke detection, are you using AI? And in this case, it dropped down to 40% or 38%. So overall, the majority of radiology departments that we have surveyed around the world are not currently using artificial intelligence for image interpretation. But I will predict, if I go back to this slide, in probably about 10 years or so, I think 100% of radiologists are going to be using some type of AI, but it may not be the way you consider it. It's probably going to be built into their machinery. And then over time, as we become more comfortable with interpretations and also to figure out how we pay for all of this, then I think slowly that number will end up going up. So in summary, I just like to end with these last 2 slides. And I kind of look at artificial intelligence in radiology as the great explorers. So if you look at the great explorers from Portugal and Spain and the Vikings, years ago, they would sail across the world in their ships. They would eventually get from point A to point B, and they would navigate based on the stars. They never had any engines, but eventually they would get there. But you had the boat, you had the crew, and you had the captains. So the way that I look at artificial intelligence is basically looking at our modern day ships. So with our modern day ships, you still have a ship, you have a captain, you have a crew, but you have a lot of different softwares and different technologies like compasses and echo sounders and autopilots and radars and GPSs that allow us to get from point A to point B, it's just going to be a lot faster. So in the future, we'll always have radiologists. We're not going away, but AI is going to help us get there quicker. And I predict in about 10 years, about 100% are going to be using AI in one way, shape, or form. So thank you very much for the honor of this lecture.
Dear Professor, I believe that people in audience enjoy. It was really very, very nice. And I know that they are not all radiologists, but it's also good for the people to hear what has happened and what will be. It's necessary to know that radiology will be in future. That's nice. Okay. Are there any questions for audience? Ima li pitanja, da li neko nešto želi pitati profesora? Ako ne, mi ćemo mu se lijepo zahvaliti, pa ćemo izaći vani, pit kaficu i možda još par riječi koliko profesor bude imao vremena. So we will go to have a cup of coffee because no question. Do you want to say anything else? Maybe. You're welcome. Enough time.
Yeah, I think I just want to end this out by just expressing my. Oops, okay, I got you. Now, I just want to express my gratitude for being here again. Thanks, Svetlana. We just happened to meet by chance, and she really orchestrated myself coming here. I want to thank the Erasmus course and Zublea. I think I've got her name. Who's wonderful. It's like I said, it's my first time to this part of the world. I know the challenge that you have, but I really think of this area as the phoenix. I don't know if you know the story about the phoenix. The phoenix lives, it has challenging times, but it's being reborn. And from my standpoint, I've been so impressed by the resilience of the people, the kindness and the generosity and the intellectual curiosity, and really all the talent that I've seen in the young generation. So, you know, I'm personally not going to change the world, but, you know, I hope our relationship can continue. And, you know, my hope is that if I can change the world one person at a time, maybe work with junior people or in some way inspire people or instill some sense of optimism, I really see this country rising like the phoenix. And I think the future is very bright. And I appreciate being able to come and spend a time with all of you. And hopefully we can continue this in the future.